Hello. Today I will be sharing with you the process of writing a nursing diagnosis and analyzing the parts of a nursing diagnosis. A nursing diagnosis is a statement of actual problems or potential risks that a patient has in which a nurse can competently treat. For this presentation, you will need your nursing care plan textbook, paper, and a pen. The learning objectives are as follows. After watching this screencast, you will be able to analyze the parts of a nursing diagnosis and create a nursing diagnosis correctly. As a traveler plans a trip, so a nurse plans nursing care. When someone goes on vacation, he or she follows a similar process as the nursing process by assessing the need for the vacation, determining the location of the vacation, planning the vacation, implementing the plan by going on vacation, and then evaluating the plan and adjusting as needed during the vacation. In nursing, the nurse uses the same process to assess the patient's needs, create nursing diagnoses, plan the care, implement the care, and evaluate the care. To limit the topic of this process, this screencast will only focus on creating nursing diagnoses. When a person plans a vacation, one could say that he or she is in need of a vacation related to increased overtime hours and lack of time off, as evidenced by feelings of being overly stressed and lacking sleep due to increased thoughts during the night about the workload. We will now apply this concept to the diagnosis. The first step for creating a nursing diagnosis is to gather information about the patient by taking vital signs and performing a physical assessment. The second step is to list abnormal findings to analyze the patient's needs. In your care plan textbook on page 1099, the nursing diagnoses are categorized by the nursing focus of concerns. When you have determined an area of concern based on the abnormal findings, this section will help you narrow the nursing diagnoses. I would like you to pause the recording, turn to page 1099 in your nursing care plan textbook, and become familiar with this section. As you probably noticed, specific nursing diagnoses are listed for each nursing focus. In a nursing diagnosis statement, there are three parts: the problem or risk, the cause, and the evidence. In the first part, the actual problem or risk is listed, which must be NANDA approved and found in your textbook. The problem is followed by related to, and then the cause or etiology of the problem is written. Then, as evidenced by is added to the statement and followed by the signs and symptoms showing evidence of the problem. Please note, if the nursing diagnosis is a risk for diagnosis, then as evidenced by is eliminated from the statement because it is not an actual problem yet. Now turn to page 600 in your nursing care plan textbook so we can look specifically at the nursing diagnosis of acute pain. Please pause the video and create a nursing diagnosis of acute pain completing all three parts: the problem, the cause, and the evidence. Did you include all three parts in your nursing diagnosis statement? An example of a nursing diagnosis for acute pain would be acute pain related to physical injury from the appendectomy as evidenced by patient reports incisional pain to be 7 out of 10 and patient expresses facial grimacing with mobility. For your final activity, I would like you to complete 3 nursing diagnoses for a potential patient. Pause the recording and do that now. As a traveler must establish a vacation destination in order to plan a vacation, a nurse must establish correct nursing diagnoses to create an appropriate nursing care plan for a patient. This concludes this screencast. Keep practicing.